Good morning, everyone. Thank you so much for joining us this morning. Again, I'm Senator Susan Rubio. I represent the 22nd Senate District in the San Gabriel Valley. And as a public school teacher for 17 years, I truly do understand the incredible shift of responsibilities and disruption to our family life because of COVID-19. And I know it's a new normal. So we'll try and give you some information that can help you moving forward. I've been engaged in many conversations with my fellow teachers and families, as well as my own constituents, in particular with families who are struggling with educating their children at home, and for parents that are work parents, they're trying to figure out how to balance home and work life. So hopefully we can give you some insight and help in that regard. We also have heard concerns about how to listen and talk to children about the pandemic, what's appropriate, as well as needing parent strategies to cope. And in particular, we're going to touch on family mental health in general and how to keep our families healthy, especially the relationships during these stressful times. So I've heard many of your concerns out there. Thank you for sending your questions. And I thought we would put together this panel of educators and doctors to let you know first, you're not alone. Many of us are facing the same challenges. And second, there are strategies and resources to help parents help their children and again, figure out how to move forward and cope with our new normal. So once again, thank you, all of you, for joining us today. The format of this teleconference is as follows. We've requested the questions in advance from our constituents and our listeners, and we've also talked to our panelists about what they've seen out there. You can also send me questions right now at senator.rubio@senate.ca.gov, and we'll try and get to them at the end of this teleconference. We're going to direct the questions to our experts, and they'll answer those questions for us. At the end, we'll set aside about 15 minutes or so for final thoughts and important takeaways from our panelists. This discussion will also be live streamed with closed caption available on my website at sd22.senate.ca.gov. Once again, that's sd22.senate.ca.gov. Now, I would like to introduce our panelists, our experts, and get a couple of questions going. First, we have Irma Salcido. She's an educator for 20 years. She's now teaching in the Garvey School District from home and is also a parent of a 12-year-old who is also taking classes from home. Second, we have Dr. Glenn Masuda. He serves as the Associate Divisional Director of Pacific Clinics, Asian Pacific Family Center. He specializes in adolescent psychology, family therapy, and community interventions. Dr. Masuda, thank you for joining us. And next we have Dr. Salvador Hernandez. He works at the Olive View UCLA Medical Center. He is an internal medicine resident serving patients with COVID-19. And again, thank you, Mr. Hernandez, for joining us. Your insight is going to be valuable. So I will start rotating questions, and so please take your time, and hopefully this will help all our families. I will start with our educator, Irma Salcido. Since you're a teacher as well as a parent, and you have to straddle both sides, what are some of the challenges and solutions that you have dealt with during this time that you can offer our families?
Thank you, Senator Rubio, for having me. Some of the challenges that I found as being a parent/teacher is the issue of time. Many times we've said, oh, I don't have time for this, I don't have time for that. Well, I'm at home now. I have all the time in the world. And but my son feels that as well. And so he's like, why do I have to start early in the morning? I can do this after lunch, or I could, So our time being less structured versus going to school at 8:30 and then having class number 1, class number 2 has become a problem because there is that sense of I'm kind of on vacation. I don't need to do this right now, And so the solution to that is I put us both on a schedule. And so we still start the day, have breakfast. Now we go walk the dog in the morning, but that's kind of our routine. And then at 9 o'clock, rain or shine, we're starting our work. And he goes online for his online lessons, and I go online to do my online lessons for my students. Another challenge that I faced is that struggle between me being a parent and being a teacher for my child. He thinks that I'm being harder on him than his teachers would be. He thinks that I'm being more strict than his teachers would normally be. And so that relationship has gotten a little bit strained at points. So to alleviate that, as a solution is when we're on our schedule and we're on work time, I am his teacher, not so much his mom. And then when it's time for lunch and it's time for more of the unstructured activities, then I could be mom again. But it kind of puts us both in that role. He's in school mode, I'm in teacher mode, and I can help him with his assignments if he has questions, how to look things up. He realizes now that I'm not holding them to one higher standard. I'm just doing what I would normally do with my students. Those are the two main ones. And then, of course, distractions. The phone call or the TV show or, the dog barking outside. All of that could be potential distractions. And so that's another problem that we can have. We just, again, when we're on that schedule and when we're on school mode, it helps to kind of take away from all of that. You can't watch that or you can't do that because we're in work mode and we're on work time or school mode.
Thank you so much for that. So what I took away, the key is having a structure and having a schedule and a routine as if they were in class, and also having high expectations to meet the schedule. And I guess also more importantly, minimize the distractions while they're doing actual classwork. So thank you so much for that. Next question is going to be for Dr. Masuda. What has been the impact to parents and children with the daily news and messages they see on social media? Are there ways to combat that?
Yes, thank you. Can you hear me?
Yes.
Okay. What we've been seeing is, even in the early days of the pandemic coming in, we had far too many people depending on social media for their information and constantly having to help vet the material, because I had even professionals coming in and telling me it's been confirmed, we had this, and it's been confirmed, we had that. And their source of information, unfortunately, was coming from social media, YouTube, and other sources. So we had to help with that process. The other thing I can piggyback on what was said by Ms. Salcido is that lack of structure and boundaries has wreaked havoc on a lot of people across the system, but especially for parents. We've been focusing on helping them not just with the structure, but also with the boundaries. I think having the structure, having the boundaries is helping with the one thing that is difficult, which is predictability. There's so much fear of unknown, fear of missing out information, the uncertainty. So having that structure and boundaries is really helpful. Like with what was heard in terms of the teaching, the challenge for parents and families has been, can we focus on one thing? Like we have parents who are initially feeling like, oh, this is good, I'm getting away from work now, but now many of them are complaining that they want to escape back to work. That tells you a lot about what they're dealing with. Some of the creative coping things we've been seeing is, even though they first came in with fear, we've been really, it's very heartening to see that there's been amazing courage, generosity, optimism, creativity, and hope on the part of the same parents and families, where they're asking, how can we help, whether it be our neighbors or materials or donations, or right now the big thing is making masks. But sometimes something as simple as to help with the distractions and to help with the boundary issues. When I've had to supervise my staff, I've told them, you would never allow your client in counseling sessions to sit there with their iPhone on, with the screen on, and everything else, and try to make everything as analog as possible. One really cute coping that I realized is one of my staff had basically, when I looked at her on a Zoom session, I thought, my God, you have a really nice background that's analog, real. It's not one of those virtual backgrounds. And she sheepishly acknowledged that actually it was an old shower curtain she put up behind her, and that she was currently sitting in her son's study area, that she realized that by, like doing an imaginary fort in her living room, she set up this boundary that would block out no phones, no additional screens other than ones you're working at. And it helped provide them an emotional, psychological boundary that was helpful. And even the kids would acknowledge it when she would come by and she says, "Mom, that's my classroom. You can't use it for anything else." That was kind of a nice example of the kids have started to even utilize, even in limited areas where you don't have separate rooms. There's ways that you can do these things to help them feel a little bit more in control and things a bit more predictable. Not to mention explaining to the rest of the folks in the home that please, lower your radios and televisions and other things when the kids are in their various classroom situations or for their activities. And that's just a sort of few things we've been saying.
Thank you so much. So once again, I heard structure, boundaries, also vetting materials or information coming from social media, and lastly, setting up a safe space for not only your work, but your children's work. So thank you so much for that. Next question, it goes to Dr. Hernandez. What would be considered best health practices for families at home with multiple children or high-risk individuals? What are some of the simple, easy practices for families?
Thank you, Senator Rubio. Yes, I think for before we continue with this question, I think the most important thing for our families right now is to be cognizant that there's a lot of information going on, and we can be bombarded by some of us maybe feel overwhelmed at some point. So first is probably step back a little bit and then just see where your information is flowing from, and then just follow the recommendations that are coming from places like the CDC and not from YouTubers or Instagrammers or everything like that. So that's something that I just want to share with you guys first. And of course, one of the things that we can potentially do and really easy is when we come out from the street, we can just designate a place at the entrance of our house to remove our shoes. Probably, they're dirty and everything, so just leave them in the entrance of your house. And so the other thing that we can do is remember that the most important thing right now is going to be to wash our hands at least for 40 seconds with soap and water. If you don't have any hand sanitizer, that's something you can do. People say, like, okay, so 40 seconds, how much is 40 seconds, So one of the things that we show to our patients is that they can sing in their heads the Happy Birthday song twice at a regular speed, and that is 40 seconds. So just use soap, any regular soap is fine, just like lather it with, and then just at the end rinse it with some water. And that'll be something that you guys can do before eating, after eating, when you come from outside the street, after you buy groceries or something like that. And obviously, when you're coughing, just cough in your elbow. And if you're having fever or something like that, check it out. And to the early symptoms, you need to go and get tested. But for right now, I think just wash your hands, designate a place to leave your outdoors shoes, and be careful with where you're consuming information from.
Thank you so much for that. And so I'm sure so many families are feeling overwhelmed, as you stated. And I guess what you shared was it's important to take a step back and detach from social media as it pertains to gathering information and go directly to reliable sources such as the
Correct.
CDC to get accurate, up-to-date information, and also simple strategies to wash your hands often, 40 seconds, which equals the birthday song, as well as coughing your elbow. And if you're feeling early signs, please go get checked. So thank you, Dr. Hernandez. I will now take it back to our educator, Mrs. Salcido. As an elementary school teacher, you've used technology as part of your curriculum in the classroom, I'm sure. And what happens with the parent-teacher-student relationship when you have to transition from being to being a parent? What strategies can you offer?
Thank you, Senator. So that has been a challenge, I'll be honest. I'm not here to sugarcoat that, everything's fine and everything's going perfectly, because it has been a challenge reconnecting with my students and their parents. What I use in my classroom and what a lot of teachers at my school use is a parent communication app. And that allows us to be able to text the parents information. And what I like about the particular app we use, it's able to be translated into the various languages, Vietnamese and Chinese, as well as Spanish. And so therefore, I can give announcements to the parents that way so that they know when we're going to do our classroom meeting, for example, or I'll post, like when Easter came along, I posted little messages of Happy Easter. My coworker just recently had a baby, so I posted that she had a baby, just kind of letting them in on the things that are happening at school. The parents seem to appreciate that. I get a lot of likes and views that they're, kind of keeping up to date. And I noticed that they're more willing to share with me if they're having technical problems. I keep offering my services in that issue or in that area, and they're sharing with me. They're like, I really had a hard time logging in, or can you help me with this? And I do what I can on my side to help them get a computer or get internet access or just be able to log into the website they need to get into. As for the relationship with my students, we do video conferencing, like a Zoom situation where I can see the kids. It's very important that they see each other because they miss their friends. We are in isolation, and they might see their parents every day and maybe a cousin, but they don't see the classroom that we normally would see, which is 20 kids, that they get to play with and have fun with. So video conferencing is one way that I try to kind of get us all to share in that classroom community. However, on my end, being the teacher and trying to encourage them, in the classroom, when we would have an assignment, I would walk around and I would pat my child on the back. I'd tell them, good job. I'd give them a star on their paper, something to acknowledge their efforts. And that has become difficult now. I can't see them while they're working. And so all I can acknowledge is once the assignment has been completed, but I don't know how much they struggled with it. I don't see them. So I'm having a hard time with that. Of course, I encourage them and I give them, their thumbs up, and I congratulate the kids that are doing their assignments. But it is really hard for me to check if they're understanding the lessons that I'm presenting, because that's something that I would visually see in the classroom. I would see the kids who are struggling, or I would give them exit tickets or little quick activities so that I can check to make sure that they were getting it. And now there's no way for me to do that. And so I'm struggling with that part of it. And so I'm kind of, doubling up on the parent communication. Like, if you need any help, please let me know. Or if you need any, assignment that, you need clarified, please text me, because I want to be there for my kids. And I'm finding that since I can't be there in a classroom to observe them, I don't know how well they're doing or how much they're struggling. So that's my piece on parent communication.
Thank you so much for that, Mrs. Salcido. I guess I would just add that since everyone listening may come from different districts, that communication piece is absolutely vital with your school district or your school or your teacher. So I would suggest first and foremost that all parents go to your school district to find out what kinds of communication apps they're using or technology to ensure that you're not missing out on any communication that's important. And it could be not only academic, but, that social interaction, as Mrs. Salcido just stated, just even sharing, birthdays or whatever it is to keep us in touch with one another. That's important. And I would also suggest that parents take time to praise and uplift your children as well, because as Mrs. Salcido stated, that's something she does on a daily basis in her classroom. But now that she's using technology, it's harder to really uplift a child, and so they're not getting it daily in class. So for parents to sort of fill that role a little, either, I know that as a teacher myself, I used to give incentives, and whether it be extra recess and little things that we do to motivate them, and maybe parents could come up with some sort of incentive to get them to finish and make it feel more normal. So thank you for that insight. Really appreciate it. I'm going to go back to Dr. Masuda. There's something that I think we're all hearing, and it continues to happen, and that's that myth of shortages. We know toilet paper has been a difficult thing to get, and people think that's going to disappear. So that's an example of some of the myths that are going out there. What is really the reality, and are there strategies to deal with this kind of information sharing, or how do we get information that's actual? Can you share on that? Dr. Masuda? I think we might have lost him for a little bit, so I'm just going to go over to Dr. Hernandez, and then we'll come back to Dr. Masuda. So can you, Dr. Hernandez, speak to Can you speak to how people get tested and what does that look like, and is it available for everyone? Can you speak to that, please?
Yeah, of course. So, something that came up during our conversation yesterday with one of your aides was that we have two different kind of testing. One of them is the test for the antibody, and the other one is the test for the antigen. Meaning, one of the tests is to see if you have been exposed to the coronavirus or not, and the other one is to know if you have the infection. So, what I want to make clear for everybody is that the antibody testing right now is available, meaning that it can show you if you were exposed to the virus or not. But I also want people to be cognizant that we don't know at this point if the antibodies, which is the defenses that your body creates when you have been exposed to the virus, is going to prevent you from, it's going to give you immunity, meaning that it's going to prevent you from getting sick again. So I will say that if you don't need to get this test done for any other reason, don't do this test right now because it might give false expectations to people. So the test is available. It is the one that it tells you if you have the infection at this moment. So that test is actually available for everybody who has symptoms. How do you get it done? You get it done through the emergency room most of the times. So if you're having cough, fevers of more than like 101 or 102 Fahrenheit or 41 Celsius, then you need to get to your closest ER, and then they will just do a test. The test is very uncomfortable because somebody has to insert a Q-tip in your nose, and they have to go all the way back, and just to make sure that we have a good sample. There's a lot of drive-through testing centers in the County of Los Angeles, and so that's the reason why I'm explaining how the test is done is because we have had a couple of patients that they have been requested to bring some saliva to the testing centers, and then they test the saliva. That is not the right way to do the test. So if you go to a testing center and they ask you to bring saliva or something like that, do not, that's not the right test. So you probably didn't get tested properly. So you have to get a test that a Q-tip goes all the way to your inside through your nose, all the way to the back, and they're gonna probably do it twice. But yeah, it's available for everybody who has symptoms at this point. In the future, when we have more and more testing capabilities, then we're gonna have options to test everybody until we can develop a vaccine.
Thank you for that. So what I heard clearly is that there's two different types of testing. A lot of people seem to be confused about those two. One is antibodies, and that is just analyzing to see if you had it at some point, didn't realize you had it because you didn't have any symptoms, but you were okay. You didn't end up in the emergency room. The other one is real test in terms of the current situation to see if you have it now. That's if you're experiencing symptoms, you go to the emergency room and you get the test and realize that you are infected. So thank you for that. And I will share that right now there's currently a lot of testing going on in terms of antibodies. I believe UCLA has been doing surveillance testing. That means just trying to understand the virus a little bit better, trying to see how we pass it from one person to the next, in particular trying to tackle what you just mentioned. When someone gets it, perhaps is infected, gets sick, and recovers, does that person become immune? There's also that myth that once you've had it, you don't have it again. But if I heard you correctly, doctor, and correct me if I'm wrong, there's still not enough information out there to conclude that. Can you just reiterate that point? Is that accurate?
Yes, you are accurate. Yeah, the information is accurate. So that's why I don't want people to get confused if they go and get this test done for antibodies. It doesn't really mean that they are protected against the coronavirus. It is more for, as you were mentioning, for public health and other research places like UCLA, that we want to better understand how the virus is behaving and how to better protect or how to develop a vaccine for the future. But at this point, even if you are positive for the antibody, it doesn't confer immunity that we know. So just be careful with that.
And I want to share, though, this is something that we hear often. I know that we're all getting very impatient and we want to go back to normalcy, especially if you have businesses. I know it's really difficult on families, the economy. also as it pertains to jobs and unemployment. But as the doctor just shared right now, the reality is that we don't know enough about the virus, and a lot of people seem to point to the fact that they were already exposed, and so they're okay. And the reality is we don't know. We don't know if people are safe, and so we need to have a little bit more patience in terms of allowing our medical professionals to really dig deep and really find out how this is passed on and how we can find a cure for this. So thank you for that insight, Doctor. I want to check in to see if Dr. Masood is on the line.
Yes, I'm back. My apologies.
Okay. Oh, no, don't worry. So I'm going to go back to a question that I had addressed earlier. Right now, there's a lot of myths about shortages, and we've seen the craze on TV about the toilet paper missing and everything else. Are there strategies to deal with this kind of, I don't want to say hysteria, but perhaps, that's the best way I can pose it in terms of what I see on TV. Can you address that for us, please?
Yes, we've seen that both in our own staff as well as others. I think, again, this is an interesting confluence of social media and news. Hearing families saying, well, we'd better go and buy a whole lot of toilet paper, and ask them what for, and they said, well, everyone else is doing it in China and everyone else is doing it here. And okay, so part of that is that fear of missing out, and again, the panic is a problem. Unfortunately, that panic, and unfortunately, a number of people started to hoard the materials, and I'm glad that the online shopping sites have stopped selling those materials, because I knew something was up when Costco started to say that we're not taking back any toilet paper or hand sanitizers from people. We're not able to sell it on eBay anymore. But and so unfortunately there is this artificial shortage that's happening, that people are not able to get the things that they need. So that is a reality. But the myth of it, is that you have to have 120 rolls of toilet paper, and otherwise you're not going to be able to hunker down. The sad reality is that trying to get people to calm down, but also be more flexible. There were a number of food items that started to disappear right around the time of the pandemic announcement and the shutdowns that started happening. And it was amazing that people would not buy products other than the thing that they always buy every week, every month. And so just getting folks to calm down and try other cuts of meat, other locations, other stores. I still shake my head when I walk in. I see a lot of beer is gone, but Corona beer is everywhere because nobody wants to touch it because of their own panic fantasies. But I think that flexibility is also a measure of another way of coping, is that if you can't get the particular brand of laundry detergent or that brand of paper product or that brand you used to, or you want to try different types of foods or different brands or companies of it, people have been able to cope better. The supply chain seems to be getting better as well, so that's helped calm down a lot of folks. But I can understand that if they can't find their favorite brand and type of rice, beans, etc., materials, breads, I still see that they're bringing in other store brands, and to be flexible and trying. I think that's also psychologically a good indicator of what's happening is the individuals that are fairly rigid, if you have to have it a certain way, I need to check everything off my list, otherwise it's no good, are going to have a hard time. And modeling that flexibility to the kids and families has been something we've been emphasizing is, well, try something different. If you can't get this, try a different place. It's not in this store, try a different location. That's hard given the problem of transportation for a lot of folks, but to the best of your ability, be flexible.
Thank you for that. And I will add that we're in constant communication with the Grocers Association, and the reality is that based on information they've provided, they have enough supplies, but they don't stock every single day. So unfortunately, when people hoard and take everything at one time, it does take a week or so for them to get that second shipment. So again, I think that up to all of us to be a little bit more mindful of those vulnerable individuals, like seniors that have a hard time getting to the market, maybe pregnant women who are now having a hard time finding wipes and other essential items, as well as just either a mom or dad with a bunch of little kids and having to go to the store in such chaos. So we just need to be more respectful and mindful and really take care of our neighbors. And what I got from the Groceries Association is just asking everyone to go back to your normal patterns of shopping. If you shop every 2 weeks, then shop every 2 weeks is just the essentials that you normally buy. Because unless we can go back to our normal shopping patterns, there's always going to be this feeling of running out of things. And so hopefully we can get to a place that we only take what we need in the time that we normally would do so otherwise, whether it's every month, every 2 weeks. So thank you so much for that insight. I wanted to go back now to Mrs. Salcido. As an educator, I had the privilege of also teaching in kindergarten, first grade, and I can share from personal experience that teaching older children is different than teaching younger children. I know with our kindergartners and our first graders, it requires a lot more, visual, a lot more movement. Can you share any strategies or something simple that parents with younger children can do, not just for academics and to further their education, but just strategies to maybe break up the monotony and maybe get them, their brain a little bit more flowing into the younger children?
Okay, I heard most of that, Senator. There was a bit at the end that I didn't hear, but I think you mentioned strategies that we can use with students. And
with the younger children, the ones from kinder to first to second, and I know you're a second grade teacher.
Yes, for the younger students, it's all about movement. It's all about being able to get them physically engaged. One strategy is TPR, total physical response, and it's just showing them. It's used typically with the younger kids. I've used it like for spelling words. They can spell something at a rhythm. I've used it, for example, learning the placement of the numbers on a clock. You have them be the face of the clock, and they move their little hands to the 12 o'clock position, 6 o'clock position, and so on. It gets them to be more engaged because it's more like a game. And so things like that is very important for the littles because they can't sit at any desk for more than 5 to 10 minutes, and that's on a good day, So you have to find ways to get them to have movement. And but even if it's something like a brain break, which is just giving them a chance to kind of relax for a minute, maybe do a little deep breathing in the middle of their lesson, especially when you feel like they might be getting frustrated. There's a lot of great places where you can get like yoga movements that will help them kind of become recentered to what they're doing, because again, we're talking about students that are 7 years old or 8 years old at the most, and their attention is only 2 more minutes beyond that. So trying to have a child sit at a computer for 40 minutes is not reasonable. And so you need to find ways and build in those breaks for them, for their bodies to kind of stretch or breathe or but not too long, because that is the key. Not too long, because then they'll become distracted. But make the lesson more engaging by having them move with it, clap to it, draw it on the floor, maybe with some chalk, something that gets them to cement that concept in their mind by using their body as well. Let me see. The more engaging, the more movement, the more chances you'll have that they'll be able to focus longer for you.
Thank you for that. And I will add, I know that buying supplies at home for families that perhaps don't have the means to do so, it could be a challenge when you're trying to, just be creative with teaching. And so I really like the total physical response that you shared. That means just constantly having them move around. For little ones, it's a lot harder to do so. But for those students or children that are learning how to add or subtract, I would also suggest maybe using manipulatives. That means like physically having the child use their hands to move things around. In class, we often do that, but at home, what that would mean is simply using beans that you have in your kitchen, or marbles. If they're adding 2 plus 2, having the child literally pick up the marbles and move them around to add 2 plus 2, and just seeing it visually, and as Mrs. Salcido stated, just also using body movement, that helps children really solidify the concept. And again, it doesn't have to be expensive. If you have blocks laying around, beans at home, marbles, even socks, it's. I know it sounds a little funny at this time, but it's a simple concept, inexpensive, that you can do at home. So thank you so much, Mrs. Salcido. Now I want to go back to Dr. Masuda. This is something that a lot of families are feeling stressed about. As we stated earlier, we talked about the feeling of being overwhelmed. We also talked about, perhaps parents being a little stressed, having to teach as well as, do their own jobs at home. Doctor, is there any suggestions in terms of how to take that break or release some of that stress? What are easy suggestions you could give parents out there to relieve that stress?
Mm-hmm. This is probably the most, and I feel for everyone out there who's raising an adolescent right now, because this is magnified in other ways we're not getting into yet. But I think we used to tell people all the time, stop spending so much time, screen time on television, computers, etc. And what we've noticed is a number of our consumers and folks in the community have rediscovered things like analog activities, meaning you do need to unplug. Stop staying on the screen all day long, and then you go home and stay on the screen all day long, even if it's just walking down the hallway. It sounded trite in the beginning, and nobody wanted to do this when we first recommended it, but people have rediscovered things like board games, decks of cards, puzzles. I understand there's some high-level games of Monopoly happening online or in live, in person. Even something as simple as card game. I'll raise you a starburst and check you with a Kit Kat. It was funny, but I think it was something that a number of parents they've been doing, to just do analog stuff, actually going outside and actually discovering, even taking their walks. I heard one family was doing what do they call it? A scavenger hunt, where they would look and see how many types of plants or cars, or I saw something on television where they were looking for stuffed animals in the windows because the neighbors were all participating. And when they do go to the screen, it should and can be a shared event. If you're going to watch news, watch something that is kid-friendly, like something like On the Road, Kindness 101, or the NBC News for Kids, which is on Tuesdays and Thursdays, so that even when you are actually doing something of that nature, it shouldn't be a solitary event where you're staring at the screen, but something you can talk about, discuss, and engage. I mean, I think that's so important, because there's a statement you keep hearing on TV and media, that you are not alone, and that's a great statement, but we need to find the ways where are you actually helping kids feel connected and not feeling alone. And that kind of unplugging is very helpful. The stuff that they do on FaceTime or social media, WeChat or WhatsApp and so forth, that's nice, but it's still digital. And the more they can have real-life analog communication, in addition to the positive stuff they can do electronically, I think is highly recommended to the degree you can do that safely.
Thank you so much. And I think, I completely agree with you. What I heard clearly is learning how to disconnect from, negative information that comes through either, YouTube, Facebook, or other mediums, and turn that energy into a more family-oriented or community-based activity that, such as board games and puzzles. And I think that's great advice, because being on devices such as social media, only keeps you isolated. You're not having real conversations with people or activities or movement. But thank you. And I think that not only helps in bringing the family together, but also I love your idea of, working with your communities, even if it is from a distance. So thank you for that insight. I think that that's very valuable. I want to go back to Dr. Hernandez. And I know that we talked about quarantines and what that looks like. We do know that there's some family members that are essential workers that have to go out into the field. I personally have a staff member whose husband is a medic, so he has to be out and potentially exposed. What suggestions would you give families who have those essential workers that come home? What does quarantine in a household really look like? What are some of the suggestions for them to keep their distance?
Yeah, that's a very good question. So, um, specifically talking about like people who has people who are exposed to other people or patients, like for example in my case, what we recommend is that if let's say if your family member lives in a two-bedroom apartment and has two bathrooms, then as long as you are, if the other person is not having any symptoms, obviously just wear a mask, wash your hands, use one of the restrooms only, and not share with the other person. Also, separate the utensils that you guys use and everything. And obviously, if the person is having symptoms, get tested for that. But for people who's not in this particular boat, like for regular people who don't have any family members who are in the medical field or something like that, the most important thing is understanding the quarantine term means staying at home. I have seen multiple people just like saying, well, we're staying home, but I'm still going to visit my daughter, going to visit my mom and eating with them and everything. Remember that even if you have no symptoms, it doesn't mean that you don't have the disease. And if the people that you compromised or they're older, they have asthma, diabetes, or some other comorbidities, you're putting these people at risk of getting the disease. So just please stay home. I know it can be, it can be boring, it can be stressing and everything else, but for right now, you need to stay at home and just go outside to buy, as you were saying, groceries, essential needs. Maybe go for a run or just walk around your neighborhood, but don't visit every other household. Just this is not a social time that we are having to visit each other. I mean, you can see each other on Zoom or FaceTime or Duo or any other means, but for right now, just try to stay as much as possible at home. And if you're not able to self-isolate properly, there's multiple resources in the community from public health that they're offering to medical professionals and people who have been dealing with coronavirus. For example, the state of California is giving hotel rooms to health workers so they can use them instead of going back home. I know some of my other friends, what they're doing right now is they're like sleeping in, if they have a second house or if they have a back house in their backyard or something like that. And if you happen to be somebody who has the disease, also public health is able to give you some temporary housing until your quarantine is ended so you don't infect other people in your household. So there's multiple resources. It's just a matter of asking or doing some research about this stuff.
Thank you for that. So I just want to reiterate some of the important points I heard. So if you live within a family that has potentially someone that has to go out because they're essential workers, either grocery stores or first responders, it's important to try and wear a mask inside the house, separate utensils within the home for those that have to go out. If you have two restrooms, possibly designate one of those restrooms to the person that has to go out and everyone else use the other one. And finally, which I heard is key, not just from you, Dr. Burke, but so many medical professionals, true quarantine means don't interact with others as much as you can, and that includes family members. And I know it's the most difficult thing to do. I still see sometimes postings of friends and families getting together for barbecues, and as the doctor shared, you may not have symptoms, but you may be exposed. And so true quarantine means stay in your home and avoid even gathering with family members. Thank you for that. I want to take it back to Dr. Masuda, which is something that I think gives anxiety to many people, including myself. What do you see as we start opening up? Any conversations for parents that might want to get ahead of it and speak to their children or partners about what that looks like? What should they prepare for?
I think we're talking about the recovery process once we start coming out of this.
That's correct.
Yeah, okay. Let me start with something very, very basic and very important and powerful for parents in general. is permission giving. Right now we're dealing with the immediate crisis where people are not eating or they're crying or they're having behavior acting out, and we do encourage parents to please contact local mental health services and resources to get consultation. A lot of my agency, Pacific Clinics, is, for example, operating remotely, but we are trying our best to deal with any of those and not wait for it to get to the point of crisis. Remember that although the news talks about whatever domestic violence or abuse that might be going on, and people are talking about racial scapegoating that is occurring, that's in the immediate situation, but for the foreseeable future, different kids are going to respond differently. Some are going to come out of this and look like nothing is wrong. Others are going to immediately be in need of some consultation. Please give them the permission, yourself the permission, to get that consultation. I think this is not a time where the fear or stigma of mental health services should prevent you from at least asking. If you're going to start that conversation with your teachers or your ministers in churches, temples, synagogues, and other locations, mosques, that's fine. But just remember that that's another part of not feeling alone. And your modeling as parents, that permission to ask for help, ask questions is so important. I'm not so much worried about the ones who are currently crying and acting out and having problems because they're easily identified. I worry more of the ones who will either say, I don't want to talk about it, or I don't need to go there, or no, I'm fine, and behaviorally something's up, and not to take the unfortunate stance of saying, well, they'll grow out of it. There is this notion of what doesn't kill you makes you stronger. I cringe when I hear that because that may be true for some, but not for all. The way we all cope, there is no one-size-fits-all. And so here again, you parents and family members have this incredible ability to model the help-seeking or at least consultation behavior. And I'm going to say it again, permission to talk about it is so important now and in the near future.
Thank you so much. And there is a stigma within some of our communities about reaching out for help. I know sometimes it's not perceived as something that you need unless there's something wrong with you. So thank you for saying that. So ultimately, families, parents, all of us need to analyze the emotional or maturity level of your child or student and encourage your child to talk about it and encourage your child to say when they need help, if they're really struggling with it emotionally, to speak about it, as well as adults. I know adults sometimes can be harder than children because we're, older and set in our ways. But in this time of crisis, we may not even realize that we're feeling emotionally distressed, or, it's going to be different things coming at different people. Again, as we talked about unemployment, perhaps a rent issue, a landlord issue. And so just learning that it's okay to ask for help, learning that it's okay to talk about it, whether it be, as you said, mental health professional, your church, a neighbor. So thank you for that. Let's encourage each other to talk about it. I'm going to take just one more question because I see that we're getting close to the hour, and I want to be respectful of everyone's time. A question came in, which I think it's important, and I'm just going to see if Dr. Masuda, Irma, or any of you want to take this question. Someone asked, how do parents explain to their kids when they are following the stay-at-home orders and doing everything that they've been asked to do, but then they see people at stores shopping and hanging out and ignoring the stay-at-home orders, or perhaps ignoring such simple things like wearing a facial mask and keeping their distance? How do they address that with their children? And that's for anyone who wants to take this question.
Oh, my goodness. It depends on the situation, who they're seeing. If they're just seeing strangers as one response, if they're seeing friends and relatives. So please understand that there's not one generic response set to it. It's very nuanced depending on who they're seeing in the situation. But I'd like to try to put a positive spin on it, is that we're doing this. In the news, you'll see people who say, it's my life, my choice. And what I've tried to explain to a lot of kids is, I understand that declaration of freedom, but it's also coming from a very selfish place. The reason why you wear masks that are made out of cloth or surgical masks, and not to take away the ones that are needed by medical professionals, is less about protecting yourself, but to acknowledge and protect that you're helping and protecting other people. And so I try to reframe it as sometimes people have a hard time when they're scared not to be self-focused or selfish, or they need the release and they're so panicked, and that, it is part of being strong and helping and being unselfish and thinking of the community and not just yourself is one way we've tried to explain that for some of the families. And not just simply give if your friend jumps in the lake, are you going to jump in the lake too? It's like, no, it's an interesting opportunity to point out that sometimes people, when they're afraid or they're pressured, might start acting a little bit more selfishly. And we want you, as our family members, to think of everyone else, not just ourselves, in this process. And that's one example of what we try to do with our kids and families.
Wow, that's incredible. Thank you for that. And I as a teacher, I can tell you, I'm sure Mrs. Socio can concur on this issue. We find that a lot in our classrooms where, maybe students and kids act out, do inappropriate things, and they love pointing to, my friend did it, or, so-and-so did it. And sometimes they do like to admit it, what they see out there. And I think what you just explained right now is having a really direct conversation with your child and family member about, how people act when they're scared, and perhaps they don't always follow the rules. But just focusing on the importance of, the household and being, mindful that you want to keep your household safe and you care about others. I think that's important, and thank you. And sometimes we kind of not really recognize how, even young children, 6, 7, 8, they listen and they're capable of understanding right and wrong and just reiterating what's appropriate. I think it's important. So thank you so much. We're coming down to 8 minutes left. So at this point, I want to take a time to say to all of our listeners, thank you so much for taking the time this Saturday morning to join us. And I hope that this information has been helpful and you can take it back to your homes. We'll try and have another one in the near future. But at this point, I want to also thank our panelists. Your insight is invaluable. Thank you for sharing your expertise. And I'm going to start and give each one of you the ability to close, give closing remarks, and maybe highlight 2 or 3 things that you want our listeners to take away as a priority. And I will start with our educator, Mrs. Salcedo. Any closing remarks?
Yes, thank you, Senator. My first of the remarks I want to say is that parents, you need to acknowledge or remember that you are your child's first and primary educator. And a teacher is a super important component of your child's life, but they're there for only those 10 months of the year, and you're going to be there for the long haul. And why I make that a priority is because children model their parents, and they'll model their attitudes, their feelings, and everything we've talked about today, from being able to be given permission to show feelings and being, able to stick to a schedule. Like I said, it's all coming from the parent. And so if we can, be cognizant of that, be aware of that, I think it'll make our actions a little bit more meaningful. If you wear a mask, your child will wear a mask. If you set a schedule, your child will follow the schedule, and so on. And my other comments would be, try to stick to a schedule if you can. I find that it's been very effective with my students. Give them encouragement every time you get a chance, because it's about the process of the learning that we want to encourage. A child will not always get all the answers right, but they learn from your encouragement to keep trying, to keep working hard. And whenever possible, try to, make the learning fun. There's virtual field trips, but you could, do some yoga with your child. You can, do deep breathing. It might help you as well. All of those things are learning opportunities that you can share with your child, and they will see that you are not only the teacher in your house now, but you're also learning as well.
Thank you so much again for joining us today and giving us your insight. Now I will go to Dr. Masuda. Any closing remarks or important takeaways?
Thank you, Senator Rubio, for this. It's probably a good example of saying to the families and the parents that, we got your back too on this. You are also not alone. So I thank you for this forum. Aside from the things I've already mentioned, I guess one thing I try to give out there is, parents, you are the single most important person in your child's life, and yes, that includes your teens. It may not always seem that way, but yeah, they may not listen to what you say, but they surely do watch what you do. So keep that in mind, that you hold a lot more power and credibility than you realize, and we want to support you in that. I guess a final piece and takeaway that I've done lately is that right now a really important coping is humor, and humor can be, laughter in particular, can be a very, very healing process. But remember, only if that humor is shared. If that humor is targeting people or persons, it can be very destructive. So even there, how important it is for you to model that, not just the coping, but also the humor as what you're doing and engaging with your family. So remember that piece, please. It'll go a long ways in the near future. Thank you.
Thank you so much for that insight. And again, what you have shared has really been very important for our families. Next, I will give Dr. Salvador Hernandez the opportunity to give any closing remarks or important takeaways.
Thank you. Well, I just wanted to let everybody know that stress and anxiety in general is never good for anyone. And obviously, right now we are, feeling varying degrees of it right now. But for the reason, my best recommendation right now is to, just get information from right sources like the CDC. Do not ingest any disinfectants, please. And just wash your hands, wear the mask where you're supposed to wear your masks. And if you have symptoms, don't wait. Just go get tested and just stay indoors. And as people are saying, just yoga, find a book to read, just prevent you infecting others and others from infecting you, just from staying home and doing a good quarantine, please.
Thank you so much for that. And I will just leave my last thoughts here. Again, being an educator for 17 years, I also know how important writing is, and sometimes we forget to do that for our students and our children. So I don't want to overlook the fact that we are dealing with a very important time in history. There will be books written about this era, just like the 1918 Spanish flu pandemic, and having your child capture history is probably going to be very beneficial in terms of just writing things down, but have them just create a daily journal and maybe set aside, 10, 15 minutes to write down what they see, what they hear, what they feel, and if possible, and you get the newspaper at home, perhaps cut out clippings of, daily stories, just so they can, at the end of this, they can capture, a little journal with the history, and maybe, 20, 30 years from now, even 50, they can look back and have their real end time moment of history, and they can share with their children, their grandkids, and so again, it helps just, let out some of those emotions that are, that perhaps they cannot share with you. They can put it down in a journal, but also it will continue to help them with their writing skills, continue to practice daily, good sentence structure, and again, just capture their feelings. So I will leave it at that. Thank you so very much to our panelists, to all of you that joined us today. Thank you for your time. And we hope that we can continue the conversation at a later date. Really appreciate it. Again, don't forget to go to my website to get information on resources and other valuable information that may be useful to you. Thank you, and have a wonderful afternoon, and stay healthy. Goodbye.